not, same signal. All right, thanks very much. For a few months now.
Yeah. All right, so good morning, or actually it's good afternoon, Commissioners. So I would like to give an update this month. Our primary update to the Commissioners is going to be related to our fiscal year 18 budget, which should be included in your packet. And so we're going to cover that, and I would like to introduce Allison Magda, and she is our CFO. First, and to give some background related to Lifeways, as you know, over the course of the last couple of years, we have evolved our business model. We were a prepaid inpatient health plan. Back in 2014, the state of Michigan had made the decision to consolidate the number of prepaid inpatient health plans, and we had to move from a business model of managed care to that of service delivery. And so that has been a primary focus over the last couple of years, and our budget reflects the work of those activities over the last couple of years. And now I will turn this over to Allison to be able to kind of talk about the highlights related to our fiscal year 18 budget.
Good morning to all of you. In your packet, I'm going to start with slide 3, which kind of goes over our revenues and our funding for fiscal year 18. Our total projected revenues for the year are $64.4 million, and of that, Medicaid provides approximately $51 million of that. Healthy Michigan, $4.7 million. Autism funding, which is a program that we have really grown over the last 3 years. If you looked at our funding for FY16, we were projecting about $250,000, and we have grown due to the autism expansion up to approximately $5.4 million for fiscal year 18. So that is a program that is really expanded to be able to serve those that meet the benefit up to age 20 now. And our grant funding is just under $850,000. And skipping to the next slide, 4, general fund has maintained a stable amount for this fiscal year of about $1.57 million, and those are monies that are used to serve the uninsured, as well as to provide the cover spend downs and to cover some of our admin costs and things like that. Local revenues from the 2 counties are $754,000. Special programs and other sources of funding are at about $1.4 million, and those are first and third party payers, so direct payments from consumers as well as insurances that they may have. United Way program support for the 211 program as well as the new Navigator programs, and some rent revenues in there. On slide 5, and I believe this morning I noticed that I had started building in some FY17 items. You did not get the correct updated slide, so what this is talking about, slide 6 is going to be having our projected revenues for FY18, our anticipated expenses, our slide 7, as well as a pictorial of the expense breakdown on slide 8. Sure, absolutely. If you had a scanner, I could hold it. Operating revenues, again, slide 6 of
That's okay. No, go ahead.
Oh, okay. I could, if you don't need. Okay. Of about $6.4 million, and again, it shows the breakdown of those items that I stated earlier between the Medicaid, our United Way revenue, local funds, some of our major categories there. Slide 7, again, is an overall summary of our expenses for the year, kind of broken down by our major departments, governance, which is, the overarching administration, business operations, our clinical, which is going to be like our access center, physicians unit, medical services, that type of thing, and then our group homes that we do own would be on there as well. The slide 8 shows that in a pictorial, so you can kind of see that our major expenses are our provider network, which we outsource services to, so that is approximately 75% of our budget. So it is the main focus outside of what we do internally is to get those services out to consumers. We have an additional 14% of that internal, the clinical services, and then our grants really are more consumer focused than providing administrative help, so providing, the ability to, say, expand IT or strengthen IT or things like that. It really is more consumer focused. Slide 9, we're looking at key points for expenses. Our projection is approximately 90.4% of the budget is dedicated to direct services. Again, both internal and external. Right now, we're at about 9.6% for operations, so those are the support services, finance, human resources, governance, those areas, IT, infrastructure, data integrity, data security, maintaining that HIPAA compliance that we have to keep. We also provide additional consumer supports that are other than direct services, is a component of that. We have data analytics, our quality improvement, and then reporting to outside stakeholders such as the state, the counties, and consumers, because it's important that they get that information as well. Slide 10, taking care of those that we serve. One of the big things that we had come in this past year, fiscal year 17, was the SAMHSA grant, and FY18 is going to be the second year of that grant. And it's a 4-year grant totaling approximately $1.6 million to promote the integration of behavioral health and physical health at our facilities.
You say slide page 10?
Well, page 10, yeah, for me, it is,
Okay, because I'm looking for one, all right.
okay.
Yeah, there's the PowerPoint presentation. I think she's on the last page of this now.
Oh, that's the overall budget, I believe.
Oh, that's the old
Yeah,
know that
not my
this is-
snapshot that I sent, so that's the overall budget. Yeah. So that could be causing the confusion. I did send more of a
We
snapshot.
only have one item showing. Board docs. And it's this one. Yeah, that's this one.
Yeah, we had sent
Yeah,
ahead of
a
time
PowerPoint.
presentation.
Um,
Thumb drive or anything?
No, I did not.
Because I don't see it, all I have is this.
okay.
We will make sure that you get that, and I apologize for that. I do know that Karen sent it. So,
Okay. Oh, yeah, that could cause that, yeah. That would be the reason. And another item is Jackson County is a recipient of the State Innovation Model Grant, and we are participating in that award and are working towards opening a Crisis Relief and Recovery Center in approximately the second quarter of FY18. And then some new items building on our prior year's progress. The bond monies that are remaining from the roof project from the 2015 bond are going to be used for redevelopment of the front entry for improved flow and consumer experience. Over the last year or so, we have implemented KPIs, which are key performance indicators for all staff, to set expectations around productivity, job functions, and customer service, which again improves productivity and hopefully drives down cost. And since FY 2016, our staffing level has actually reduced by approximately 16%, while the number of service contacts that we have has increased by over 5%. So we have lowered that administrative cost and are bringing up that consumer contact. So, I don't know if anyone has any questions on anything in particular.
Committee or anyone else, any questions? I know it was a little confusing there. Daniel and I have seen this before, so Daniel and I are aware of what was just presented, and I think Daniel will attest as well that overall, Lifeways is, again, I've mentioned this before, is doing an excellent job, and everything's looking up moving forward. A lot of challenges because of the state and different requirements, but Lifeways is certainly the front runner in what we're doing, which is reflected in this budget and the presentation that apparently didn't get here. So if nothing else, there's no action needed on this. I really appreciate it. Allison, Mary Beth, thank you very much.
You have a good afternoon.
Go on to 4C, Region 2 AAA. And we have the CEO, Julie Weatherby.
Good morning. And I have Margaret O'Malley here as well, or afternoon, I guess. It's officially afternoon, so good afternoon. You all should have received my report ahead of time. All of the dollar amounts spent in Jackson County are listed on there. And I want to add a couple other numbers that weren't on that report at that time. So far, for fiscal year 17, which is October 1st of 16 through September 30th of 17, we had 4,470 calls from Jackson County residents to our offices. And so that's, and if you remember the last time I was here, I talked about we have a new tracking software. So we have, it's called MetaWare, so we can keep track now of all of our calls, where they're coming from and who we refer them out to. So that is great information to be able to share on those number of calls. Many of those we do refer back out to the Jackson Department on Aging if they're not folks that we can help, or other community resources. As far as the Medicare Medicaid Assistance Program, as we affectionately call MAP, we've served 3,069 participants with our MAP program. And just so you know, we're about to ramp up for that again. That's where we do one-on-one counseling with folks that have questions about their Part D plan or are new to Medicare and need help with signing up for Medicare. You may have heard about that at the federal level. That was one of the programs on the chopping block at the federal level. Right now, it's funded at the existing level with the continuing resolution, but we're really hoping that they keep that program in place. As an agency as a whole, we saved clients we've counseled over $1.5 million, and that's in Jackson, Hillsdale, and Lenawee County, so it is a really important program that constituents use all the time. And there is a 1-800 Medicare number that you can call, but that's like over the phone counseling. We do in-personal, one-on-one counseling with folks. Other things that we're doing, our board has helped us fund continuing with our community education program. So we are continuing to do around the counties, Matter of Balance, Diabetes Path, Regular Path, Cancer Path, Chronic Pain Path, creating Confident Caregivers education to community members. And the board has authorized a full-time position to keep that going throughout the 3 counties. That's great outreach to our 3 counties, so we're continuing to do that. We did have a new grant that we had last year, was called Prevent, and we did a Safe Haven project with, which was focused on prevention of elder abuse, and we worked with APS to have a safe refuge for folks that were victims to have a place to stay while they were, we helped them sort out the problems that they were facing. So this was successful. We've continued to do a lot of marketing and outreach so that folks in the community know about the Area Agency on Aging, what our function is. And this is demonstrated by the increased number of calls that we've received to the office as well as walk-ins. It's not uncommon to see several people come in throughout the day to find out about programs they may be eligible for. We are also part of the State Innovation Model Project. more on, we attend a lot of meetings to make sure the voice of older adults and disabled adults is heard in this plan. And we are also lucky enough to be one of the pilot areas. One of the things that we're working on with the SIM, which is to have a closed-loop referral system, so that if we get a referral and we can't help somebody with it, we can, through a software program, send the referral on to another agency to see that they can help the people, so that it's just going to be really wonderful, more for the participants, so they can make sure that they're getting the help they need. Staffing is going well at the agency. We have had a couple rounds of interns from MSU School of Nursing, and that has been really important. Like, they've helped us with some research projects, but they also are learning about the aging field, and hopefully some of them will choose to have their careers there. We also have social work interns on a regular basis from Spring Arbor College and Siena Heights. Another effort that we're working on right now is Community for a Lifetime. It's a designation by the Aging and Adult Services Agency, where they want us to work with different townships or villages, cities in our region to have this designation. What it means is the area is a great place to live for anybody of any age. We're in the process with Brooklyn right now, because that's where our office is, but we plan to reach out to Jackson, Hillsdale, and Adrian and start working on those designations in the next few months. Assistive technology, we have a staff member who's an expert on technology. He presented at the area agency conference in Lansing last week, and there's a lot of new technologies that can be really helpful for folks staying in their homes, as far as electronic devices and just regular one-of-the-day advices that are assistive to older adults that are make life easier. One of them is the new, and I forget the name of the Google app thing that has a little box where people can call and order something online. They can ask about their calendar, so it's all hands-free, where they can do that sort of thing without having to type into a computer or whatnot. We're also part of the Tomei Pace Center, and they have reached a client count, the last I checked, of 73, and so they are increasing their number of clients they serve, which is a great program. I'm not sure if you've all visited the Tomei Pace Center, but it's an all-inclusive spot for folks to have their doctor's appointments, get their meals, have their laundry done, anything that can help people stay in the community as opposed to going to a nursing home. So it really is a great spot, and I encourage you to visit. Any questions for me?
Sure. Mr. Chairman?
Tomei Pace Center, how does a person get in contact with them to start it going? I guess would be my question. And what pre-qualifies somebody to be
Yeah.
out there?
All they have to do is give the Tomei Pace Center a call. I don't happen to have the number here with me, but I can get you the number. And they have an eligibility process similar to ours. They have to require a service. They have to have Medicare and Medicaid, and then they have to meet nursing facility level of care. So that means that they would be eligible to be in a nursing facility, but this is another option to that.
So, you're going to be on Medicaid?
Yeah, I think there's an option for some folks if they want a private pay for, if they don't have both. That's not utilized that often, but I think there is an option for some private pay as well. I would have to check on that one, because I think they could go out there, but let me check. I can follow up with an email on that.
What would be needed then, correct?
Yes.
Thank you very much.
Go ahead.
Hi.
Hey.
I have 3 questions for you.
Okay.
One, what's the difference between the Tomei Center and a rehab facility?
The Tomei Center, the rehab facility is more where you live there and stay during your rehabilitation. At Tomei Pace, you still have your own residence, and they actually pick you up with a bus and transfer you to and from the center up to 3 times a week. So you go there and get your services, but you're not actually living there.
And what services do they provide again?
They actually have a doctor on site. Anybody that's in the Tomei Pace Center has to use the Pace Center doctor. They have, so they can see the doctor there. They actually have a dentist come in. They do some physical therapy there. They do their laundry. They have meals while they're there and socialization. And then they also can set up meals to be delivered to their homes as well if they need other meals.
Okay. My other 2 questions are, I take care of a lot of old people,
Uh-huh.
and so on. And I saw that the services here for in-home services for home care assistance, home delivered meals, household maintenance, and so on. My question is, how do I get my patients access to this? I mean, I
Yeah.
have 2 sets of patients. One's are in a hospital, have had an operation, and they can either go to a rehab facility, or sometimes they can go home with this stuff, okay? Okay, and the other ones where I have people who come to the office with their families, and they say, well, really can't take care of all this stuff, now, okay, and so on. What can we do, okay, and so on. And so, when I see this here, my only question is that, how and what number do I tell them to call, or how do I get them plugged into the system?
Okay. They can call us at the Area Agency on Aging, and we can help do a referral, or they can call the Jackson Department on Aging, and meals and things come through the Jackson Department on Aging. There's usually, it's geared many times towards low-income folks, but I think private pay, people can pay for meals if they can afford to do that too, and they can still be delivered.
Okay, all right, thank you.
But I would like to talk to you about that too, because there may be some other partnerships we can do about some of the referrals and things, so I'll put on my list to give you a call.
Thank you.
Okay, anyone else have anything? Daniel?
Just want to say I'm pretty sure Meals on Wheels saved my neighbor. She's a elderly lady, elderly lady. She gets Meals on Wheels, and I hadn't had the chance to go over to speak to her, but I notice every day when Meals on Wheels pulls up to deliver her meal, and probably about a week and a half ago, they pulled up, and then maybe about 10 minutes later, the ambulance and the fire truck pulled up. So
Yeah.
it's definitely a good service for more.
Yeah,
than
it
just
really
the food
is. The
itself.
only part of it is the meal coming. It's the visit from the driver to check on somebody. People don't always think about that, but it's important that they have that person checking in when they deliver the meals, because that's not an unusual story.
Okay, thank you. Well, looks like you got some follow-up here, too.
Okay,
Thank you,
thank
Julie.
you.
All right. Hey, Martha. Okay, Margaret.
But I'll answer to anything as long as you smile.
Oh, okay, I can do that. Okay, we're on number D. It's the animal shelter, I guess, since I don't see Don.
I have Don here, and I don't have his report.
Richard, you gonna come up here?
I can, but I don't have his report.
You don't have his report.
I've got-
We've got the report. Well, I'm sure everybody in the committee has read this. Does anybody have any questions in regards to the report? If you do, or any questions or anything down the road, certainly just give Don a call. Okay? All right, well, now we'll move on to you, Richard. Excuse me, my bad, my mistake. Let's back up. Let's, Jim, we're gonna need you here for item E, it'll be the finance, medical care facility, retirees, health, and MOE disbursement.
Thank you, Mr. Chairman, committee members. This is an annual request on the part of the medical care facility where we transfer the November interest payment on the bonds, and we also transfer back to the county's general fund the cost of retiree health care for prior retirees of the facility. Again, this is transferred out of MOE, or the Maintenance of Effort Fund, back to medical care to pay the interest payment, and also back to the general fund. Thank you.
Any comments from committee members, anyone? This is something that's done annually, so. Okay, this is going to go to the full board, so if there's no comments or questions, I'll need a motion and support. Okay. All those in favor, signal by saying aye.
Aye.
Not same signal? All right, thank you very much. All right. All right, Richard, now it's your turn.
Good afternoon, all. Yeah, I'm not sure what happened with Don this afternoon. I tried to get in touch with him, but if you have any questions on his report, I'm happy to jot them down and take them back to him. He could very well be involved in some sort of an animal-related emergency, which doesn't happen all that infrequently. He does have to deal with those, so apologies that he's not here today. The first item that we have for you this afternoon is an update to the provider services agreement with Molina Health Plan. I did a crosswalk between the current contract we have in place with this health plan and the new one that is in board docs with you today, and there are very minor changes to it. Their communication to us was that they needed to update the documentation and the contract to comply with governmental rules and regulations. So there's very minor changes in the contract. Legal review has been requested. I haven't heard back yet from Brad, but I'm pretty sure that there won't be any major concerns because he reviewed the previous one. So we're seeking your approval of us updating the contract and entering into that again with Molina Health Plan.
Okay, thank you, Richard. Committee members, any comments or questions for Richard? Okay, well, this too would be going to the full board. All those in favor, signal by saying aye.
Aye.
Not, same signal? Yeah, okay, go ahead. We got motion support. Now, questions or comments? Okay, all those in favor, signal by saying aye. Not, same signal. Okay, Richard, you're on again.
Yeah, my monthly report is in board docs, and I just want to highlight a few things from the report. We did receive a little bit of feedback from the community concerning the strategic plan that you previously approved in September, and it really is just minor kind of editing and corrections and words here and there. So no major concerns there. No changes in any of the priority areas, the objectives, or the strategies. You did hear Julie a little earlier talk about the state innovation model. There is a news brief in board docs for you as well to kind of try to keep you up to date on everything that's state innovation model related. And most of the meetings that Julie's attending, I'm attending with her, and we're trying to make sure that the public health concerns and issues in the community are addressed through the work that's taking place in the community. And we're really pleased to be part of it. It's going well. We have lots of different work groups involved and ad hoc committees that we're participating in from the health department's perspective. September 17th through the 23rd was Child Passenger Safety Week. We did do a press release to the media outlets, and that was part of my attachment to the monthly report. I think that one thing I might point out in that particular press release is really what the CDC has to say about car seats, if you will, particularly for infants and toddlers, that car seats reduce the risk of death in car crashes by 71% for infants and 54% for toddlers. So it's really important that we continue to keep the community educated and help people figure out their car seat safety needs through the program that we have at the health department. There were a couple events that took place as well. September 7th was a free car seat check held at the Green Market with Henry Ford Legion's Health, and our certified child passenger safety technician was there, and was well attended. 30 seats were inspected, 18 brand-new car seats were distributed and 6 unsafe car seats were destroyed. And you might be thinking, well, how do car seats become unsafe? Well, they are made mostly out of plastic, and in cars that can get up to 120, 130 degrees during the summer and really cold during the winter, that plastic doesn't hold up well. Plus, it is not UV resistant, and eventually some of the seats will crack, some of the straps will come loose, and so they become unsafe. So that's what we're looking for when we're actually looking at the car seats. And just in case you didn't know, they actually do have a expiration date on seats now. So it's about 5 years is what seats typically are rated for as far as use. We're also continuing to work closely with the trauma program and Dr. Schultz at Henry Ford Legion's Health concerning the car seat safety program. We had a meeting on August 29th, and we really were trying to make sure that we're doing everything we can from the health department to help the hospital meet its needs for car seat safety, particularly with labor and delivery and newborns and families coming directly out of the hospital and going home. So we had some discussion about how can we help support their need for certified safety technician assistance at the ED. They could do it in-house. They could potentially contract with us to do something. And so we had a lot of good conversation about how to sustain the program going forward with them. And I hope to hear back from them sometime in the near future. Influenza vaccine is available in the community. We do have our flu shot clinics that are running at the health department 5 days a week, 8 to 5. Feel free to come on over and we can take care of you. There's a minimal nominal copay for casuals and retirees, just $5. And county administration and the wellness team continue to support this for all of our county employees, and we think it's a great thing to be able to do. One other item that is not in my report I wanted to bring you up to date on quickly. I've had some conversation with some other community partners about this, including Dr. King at Henry Ford Legion's Health, as well as Mary Beth Leonard at Lifeways. You may or may not be aware there has been a significant hepatitis A outbreak going on in southeast Michigan since January of this year. Over 300 cases have been diagnosed in the southeast Michigan communities, including a couple in Washtenaw County of the same strain now. 86% of the people who've been infected with hepatitis A have been hospitalized, and there have been 14 deaths associated with it. So that's pretty significant outcome. So you might think, well, who are the people who are most at risk here? Well, it is very much related to the opioid prescription and heroin crisis that's taking place in the state. We have not to date seen those kinds of numbers or concerns here in Jackson County, but we're looking at it very carefully and watching it closely. And we're actually going to be doing some outreach and advocacy for, in particular, adults between the ages of 30 and probably 50 to really have healthcare providers communicate and talk with them about being vaccinated against hepatitis A. It is covered by most insurance plans, and that is the primary prevention method, is to get them vaccinated now. If they happen to engage in illicit drug activity, they're placing themselves at risk. So I'm working on that with community partners. Molly Kaiser and I will meet with Mary Beth to have further conversations about that in the very near future and see what we can do. By the way, our vaccination rate for hepatitis A in Jackson County among adults ranges from about 2 to 10%. So we have a lot of room to do something with hepatitis A vaccine. I'm hoping that we can increase that some. That's pretty much everything I had in my monthly report I wanted to share with you.
Mr. Chairman?
Take any questions.
Do we make Hep A available to our employees, especially our high-risk employees, either at the health department or within the sheriff's department?
Well, the higher risk really for both health department staff or the sheriff department staff is really hepatitis B. That's the bloodborne pathogen, and that is available through the health department to the departments.
But again, do we make A available also? Because if we're going to be dealing with this high-risk population, they're going to be exposed to it. And I realize Hep A is typically needle transferred.
Well, Hep A is actually not typically needle related. It is really a fecal oral route kind of a exposure. Sometimes exposure to, say, people who are infected and sharing things like food or sharing drinks and that kind of stuff is more the way it's transmitted. So the sheriff department really isn't at any increased risk for hepatitis A. Even our sanitarians at the health department don't receive it.
But you're telling me we're at 8% of the population,
Right.
and now I'm recommending that we help get our employees vaccinated, and now you're telling me that, no, don't bother. So which is it? Do I need to worry about my employees and
No.
make sure they're getting their Hep A shots and we educate them on that they need it? Or do we not educate them and not do it? Which is it?
You don't need to worry about the employee population. You need to worry about the general population, the public. The general population, yes, they should have shots, particularly people, where they've seen the most risk take place among the people who've been diagnosed with hepatitis A infection is homeless, those who are incarcerated, and those who are abusing substances. That's the primary risk group.
So it's not one of those things. I don't have that shot, right?
You could if you asked for it,
I see.
yes.
But it's not one of those.
No, it's not one of the, it is recommended as one of the childhood vaccinations, but it's not required.
So if you had it,
You probably would need a booster. Yeah.
Two questions. One, do you have any, it seems like one of the best ways to market the child car seat issue is if you have some pamphlets that you put in the primary care doctor's office that people can just read while they're waiting.
Yep.
Do you have that?
We do.
Okay. And how do you get those?
Well, we usually have some specific sites. It's probably primarily family practice and pediatrics where we try to make them most available, but they're available to anybody who would want them in any healthcare provider setting.
Okay, can I get some?
Oh, you bet.
Okay. Second question, okay. Hepatitis A, okay, is classically fecal mouth transfer, like you said.
Right.
And it's usually if you're driving along the road and you know, there's a farmer there with selling some watermelons and he cuts it open, okay, and it's watermelons been contaminated, okay, and so on, and you go back home and then that's how you get hepatitis A. Usually in the history, in the past, that's how it's done, okay, and so on. You know, I understand about the needle business and so on, but usually it's a foodborne, okay, hands to mouth, okay,
Right.
thing. So, you know, I hear what you're saying about this over here, but you got to look at restaurants and people who work in restaurants, okay, about washing their hands and oral to mouth stuff and so on and so forth. That's where your contamination comes from to get hepatitis A, okay, and so on. And there should be some way that you look into that and educate the public in regards to that, about washing all celery, or washing all lettuce, okay, tomatoes, all that stuff, and so on and so forth, okay, and before you eat it, and no eating of the stuff along the side of the road. I mean, that's sort of classic
Yep.
in the medical books.
You are correct that primarily hepatitis A does tend to be foodborne transmission related. And also, frequently where we've seen outbreaks take place is because of the fecal-oral route, if you will, is in child care centers. You get one ill child in a child care center, and it is really high potential for an outbreak. So it definitely is there, and we can do more education, like you're describing. We do have a mandatory requirement in the county, and I think it comes from the state food code, that all restaurant managers are certified in ServSafe food service training. It covers all of what we're talking about here this afternoon, but also their employees can take the same training too. So we sponsor and coordinate and set all that up for at least the food service industry.
Okay.
But the general public is bigger than that.
Yes.
Yeah, thank you.
Anything else for the health director? Okay, you're on again.
I've talked previously about the opportunity to address tobacco dependence in the dental clinic setting, and now we've reached the point where we do have the agreement in hand. This is a subcontract basically with the Michigan Primary Care Association, who has been doing this kind of work now with other county health departments in the state, probably 2 or 3 others at this point in time. And MDHHS asked us to participate in this project for this current fiscal year. And the goal is really to institute systems changes to improve the delivery of evidence-based tobacco dependence treatment in dental clinics. So it's an area that's available, if you will, from a healthcare provider perspective to further interface with people who may have a smoking issue and be smoking. Dentists are very much aware of the problems and the issues associated with people with oral health care. They have a real difficult time healing properly because of tobacco use, and so we're going to be working with MPCA, and I believe the Center for Family Health will be the dental clinic that will be working with us on a kind of a tripart basis, if you will, in 2017-18. So the total available funds for this is $20,000 just for this current fiscal year. We want to subcontract with MPCA because they've been doing this particular kind of work and can carry out the work plan that's attached to the contract. And the health department will retain $5,000 to support our administrative expenses and the reporting requirement back to the state. So I'm hoping that you'd be in favor of allowing us to enter into this agreement with MPCA and MDHHS, and we're hoping to maybe, if funding is available, to expand it in the future to more dental clinics.
Commissioner Hopkins?
What are they actually going to do in the dental clinic besides a routine oral examination, okay, and doing the teeth? Well, how are they going to try to get these people to stop smoking or chewing tobacco? What is the plan for that?
Well, it's pretty well laid out in the detailed work plan, but basically this is building the capacity of dental clinics to address it from a, I guess what you refer to as the 5 A's approach. Assist people with identifying that they have a problem, advise them, create the opportunity for them to get referrals for smoking cessation through the healthcare provider side of the system, and also making sure that they know that there's nicotine replacement therapy available for them as well. It's another place to engage with the same type of tobacco cessation effort that takes place in the healthcare provider setting across the community now. So that's the kind of work that MPCA will be doing. They'll be doing conference calls and site visits with the dental clinic. They've got a written commitment from Center for Family Health to participate in it. They're going to look at their electronic dental record to see if the system is set up to actually assess for tobacco dependency. So there's a lot of system and capacity going into this effort to try to make it easier for dental clinics to actually help people that they identify with addiction.
Thank you.
Anything else? Okay, I'll be looking for a motion of support. This agreement will take place here in Human Services. Got a motion of support? Okay, I'm going to change this up a little bit. All those in favor signal by saying yes.
Yes.
Those not in favor signal by saying no. All right, you got your agreement.
Thank you.
All right. Don? Only because it's you, we'll let you come up here. We read through the whole thing, we got it all, but if you go ahead and give us a short report, that'd be great.
Okay, well, first of all, my apologies for being late. I was meeting with facilities and safety systems out at the shelter concerning potential upgrades for fire alarming, door locking, possible paging system for the employees. If you went over the report, the submitted report, probably, I don't know how much detail you did, but a few of the highlights are we did do another training for the law enforcement officers as well as Department of Health and Human Services workers, social service workers, back on about a week and a half ago. Michigan Humane Society was brought in to produce that training. That's the second time we've done that. We're continuing to recruit volunteers. The second Saturday of the month, orientations are continuing. Had to cancel deep water counseling a couple times, still trying to schedule a date that works for everybody because we want as many of the staff and our key volunteers into that session as we can. Currently, it's November 20th, but there's a couple conflicts with that date as well. Stay tuned. I also met with the YMCA, the key people that organized the groups that came in 3-4 times this past summer. The intention is to do it again next year because it worked quite well this year. We did bring in the animal control officer from Ingham County and gave our staff aggressive dog handling. We're also going to bring that same person in sometime December, January to talk about the cat side of things, as well as another refresher course for dog handling. And our two newest employees went through the euthanasia certification class mid-September. We're continuing to do some of these off-site events, such as at the Hobbit Place, the Book Cottage in early September, excuse me. Tractor Supply, those events happen pretty regularly, several times a year, at both East Michigan site as well as occasionally at the airport site. And you probably most, if not everybody knows about the quarantine situation we had for cats. We did have basically a cat parvo break at the shelter, so we did have to go on to quarantine. No cats coming in, no cats going out. About halfway through the initial outbreak, another kitten broke with the disease, so we had to extend the quarantine. We're back, but we are at full functioning capability right now. So that's knock on wood a little bit. It was a good test of our response. It was just through routine disease surveillance through the staff. They recognized the disease had broken. 2 or 3 kittens were extremely sick. They died. It kind of set the notification systems in motion. We responded, closed the situation down for the cat, and cleaned top to bottom and got it under control. And then, last but not least, ground actually was finally broken on the cat habitat room. So the block is going up. It's currently about 7-8 feet tall at this point for the addition, so it's actually moving forward. I think they're looking at somewhere around Thanksgiving time for completion. Seems a little optimistic, but as fast as it's going up now, I think it can possibly occur. Well, it's a pour, trench foundation, and then the block coming up from there. They waited about a week before starting to lay the block. It was actually a 2-set. The footings were set, the footing was poured, and then they did another pour on top of that. Then the block is coming up from that point. And the underground plumbing is in place. As far as the numbers go, we are, the third quarter was about 300 to 400 animals lower than the same time last year. If you remember from the second quarter report, we were about 400 animals ahead of the previous year. So right now, we're about the same as we were last year when it's all said and done. We're not exactly sure why we had that lull for dogs, but we are now back up to about 85-90% full of dogs. We've only got 3 or 4 kennels open. The cats are full. We had 3 weeks where we weren't taking any cats in, so that was probably 40, 50 cats or so, end of September. Any questions?
Any questions? Anybody have any questions for Don? Appreciate you showing up. Obviously, you had good reason not to be here because typically you're always here, and appreciate your hard work.
Well,
All right.
thank you.
All right.
Appreciate it. And
Thank
my
you.
apologies again.
All right, Don, thanks. committee, we're on to claims that need to go to the full board. Okay, got a motion and support. Any comments or questions regarding the claims? All those in favor, so go by saying yay. Not nay. This administrator over here, I tell you. Opposed, and this administrator over here, I tell you. Okay, we're on to other minutes. Other minutes you'll see on there, DHHS and medical care facility. Get an opportunity to take a chance to look at those. I was present for those, and again, as I've said before, those are good to take a look at. November reporting schedule, we have Department of Aging, Lifeways, Health Department, and the Medical Examiner. We're down to public comment, public comment, public comment. Okay, I got it. I don't know why. It's only been years and years. Margaret? Nothing? Okay, thank you. Okay, committee member comments. Anybody here wants to comment? Okay, it is 12:52 and we're adjourned at the call of the chair.